Hello, good afternoon. My name is Sharon Barron. I'm the manager for the Regional Perinatal Program here at Oishei Children's, and today we're going to talk about infant safe sleep. We spend a lot of time doing outreach in the community, trying to help our families understand what it really means to have an infant in safe sleep. So one thing I would like to say is October is typically an awareness month for SIDS, and so it is officially the SIDS Awareness Month this month. And I need to put in a little bit of an audience alert because what we're going to talk about today can be distressing for some families depending on losses that they've had or friends that they've had losses with their infants. And so we will be talking about infant mortality throughout this session, and we would like just to have you be a little more aware that there's a very serious side to SIDS awareness and infant safe sleep. And so what we know typically is that in the United States, there's an estimated 3,500 babies that die annually from unsafe sleep environments. And we've done a lot of work understanding what that really means and how we can prevent that going forward. And that's a little bit of what we're going to get into today. So just so that everybody understands the way that we've set this up, we're going to start with some defining terms for a little more better understanding from when patients are in the hospital and then when they go home to the community. And so infant mortality is defined as the number of deaths in infants aged under 1 year of life per 1,000 live births in a given geographic location. So essentially, infant mortality really contains neonatal mortality and post-neonatal mortality. And a lot of people don't know that it's broken up into the 3 different categories. So when we talk about infant mortality rates, we're talking about a pretty large section of infants that we look at that like infant deaths that happen within the first 12 months of life. And so everyone knows the term SIDS because that was literally the first term that came out when this work started. And SIDS is defined as sudden infant death syndrome. It's also heard in the community as crib death. And so a lot of times when we are investigating a SIDS death or SUIDS death, which you'll hear about in a second, there's really no reason for that death. It's really hard for a medical examiner to determine what caused a SIDS death. And so when they get a SIDS classification, that gives us a little more understanding of in that infant mortality rate, where the numbers where we can look at prevention. And SIDS is often not one that we can prevent, but it falls under SUIDS, which was defined about in the 20-teens as sudden unexpected infant death syndrome. And it's more widely understood because that's the one where the medical examiners will classify to let people understand that that is typically an asphyxiation or a suffocation death that gets an investigation, and we learn a lot from those investigations. And so each state is set up through the CDC and vital statistics to have these death reviews so that we can learn a little more in the hospital settings and the community settings for how to educate families around infant safe sleep. The newest term that you're going to see or hear is called sudden unexpected postnatal collapse. And the reason they put that one in is because in infant mortality, we have post-neonatal mortality rates that we look at. And so this is another unexpected death that happens within, typically it's the first week of life. And so that would fall into the neonatal category of 0 to 28 days. And so we'll get more into that as we learn a little bit from what New York State has shared with us. So last year in a fall conference for reproductive justice, New York State pushed out a little bit of a split webinar series or a presentation on maternal mortality and infant mortality. So what you're going to see in this presentation is from that. And it's been presented now twice across New York State. And it really broke out by region what we were looking at. And we asked for the statistics for Western New York so that we could start helping our hospitals around Western New York join in this work and understand where we rank across New York State. And so, and you'll see in the slide, 2016 to 2019. I know that it's 2024, but a lot of times with New York State and the data, it's very slow. And so we work with dates that aren't current, but we also know that the work we're doing is making a difference because as we work as the Regional Perinatal Center here at Oishei, we look at infant mortality rates and maternal mortality rates annually. And so in the world, United States ranks 50th for infant mortality, which is not great. And so the work really started in the 1990s with the American Academy of Pediatrics when they pushed out the very first publication for infant safe sleep guidelines. And so that really started this work. And what they found that when babies were put prone, they were dying at much higher rates than if they were put supine. So prone is often understood as on their tummies, and then supine is on their back. And so when you hear nurses talking or physicians talking about the position of infants, those are some of the terminology that you will hear. And so we want to take babies off their tummies and we want to put them on their back. And in those guidelines, that's when the ABCs of safe sleep were first introduced. New York State, if you look at the slide, from 2016 to 2019 had a 12% decline in infant mortality. A lot of that was because that was also the time that New York State Department of Health and the New York State Perinatal Quality Collaborative pushed out a safe sleep campaign across all birthing hospitals and RPCs in New York State. And so some of that work is shown here. And so there was a definite decline in that rate. One of the things that we learned last year, and one of the things that we've been seeing trending across, is that once the rate comes down, it sort of stays stagnant. And so we have not been able to get that rate down to zero. And a lot of us here at Oishei started working in 2020 to start looking at what we could do to start bringing the number down for Western New York, because we knew that our rate in 2020 matched that of all of New York State. So we wanted to bring that number down. And some of the work that we've pushed out across the hospitals is really actively working in that metric. So when we talk about the infant mortality rate, we also need to talk about the health service areas for New York State. Basically, there are 8 health service areas, but there are 17 regional perinatal centers across New York State. We are one of those regional perinatal centers. Our health service area is Health Service Area 1, also known as Western New York. Western New York is 8 counties, and in those 8 counties is where we really look at our infant mortality rate. We also look at our maternal mortality rate. And we're working within different projects with New York State currently that has really highlighted this work even more, bringing together advocacy and a call to action for our community. And so what we learned, especially when they broke out the data for us in that conference, is that here in upstate, our rates are much higher than that of downstate. A lot of us talk about how downstate, they have about 8 million people in New York City, and in our regions, we don't have that many. But if you add up all the other regions, our numbers do climb. And so we shouldn't have the mortality rates that we have in upstate. And this is something that I know that Governor Hochul has committed to working to decrease with a January conference that she put out this past year. And so you'll hear a little more about that as we go forward. But Western New York, we started stratifying data when we joined the New York State Department of Health and the Perinatal Quality Collaborative Project for Birth Equity Improvement. And what that means is, as the RPC, we started sharing all of the data in the region with birthing hospitals that stratified it by race. We don't always get the infant data stratified by race, but we're working on it. And so one of the things they were able to do for this presentation was really break out Western New York's infant mortality stratified by race. And what this trend shows is that Black infants die at much higher rates than other infants. And it follows the same trend for maternal mortality here in Western New York. So now that we know and the community organizations are aware, we're all working to bring these rates down. So when we talk about infant mortality, I did talk about neonatal mortality. A little bit about this slide for takeaways. There's a lot of data here, and I know this is a community presentation. So the things that you need to know about your organizations where you're delivering your babies is that this is what we look at. We look for preventable ways to bring these rates down. The leading cause of neonatal mortality, if you look, it's short gestation and low birth weight. So New York State has pretty high rates of preterm births. We have a 64-bed level 4 NICU here where those neonates will be housed until they're ready to go home into the community. And so one of the other things you need to look at, and it's the fourth line down, but it's the newborns affected by the maternal conditions. And so as we work through maternal mortality, we also realize that there's some things that happen during pregnancy that also affect this rate. And so we're looking at how we can change that statistic in the work that we're doing through the RPC. This next slide is the one that really needs the attention. So leading causes of postneonatal mortality. So remember, neonates are 0 to 28 days, and then 28 to 365 is the postneonatal dates. And so that is also another statistic in infant mortality. And why is this work important? Well, you see in that first line that the SUID rate is about 1/3 of all postnatal deaths. And that is the one thing that is preventable through the ABCs of safe sleep and some of the education we're going to talk about today. So when we're in the community, we hear a lot of things that I think are just, we call myths that are out there. And a lot of families think that any baby that dies suddenly or unexpectedly is always a SIDS or a SUIDS death. And while that's not true, and we're learning that through the classifications of the fatality reviews, the SUIDs account for at least 1 in 3 deaths in New York State. And so there's data that's been pushed out in the last year showing that around 200 babies die annually to unsafe sleep from all the fatality reviews. And that's 200 babies that we can prevent. And so a lot of these babies, when they're classified as asphyxiation or suffocation, these are the babies that have been left in swings. These are babies that have been left in chairs. These are babies that have fallen asleep with their parents and rolled into a couch cushion. And so when we say these are preventable, these are preventable. And these stories are so hard to hear. Infant safe sleep has been normalized a lot by social media. And what we've also learned in the community is it's generational. Because when I told you that it literally started in the 1990s, there's a lot of grandparents out there keeping families that don't support infant safe sleep. They don't understand infant safe sleep. And they think that because their babies made it, that it's not really something they need to worry about. And not every baby is going to sleep in a bed with a family and not wake up. We know that. But it's a 50% chance of that baby not waking up. So it's something that families need to hear. In 2022, the American Academy of Pediatrics published, again, new guidelines for safe sleep. So things that they sort of waxed and waned on and said, we really need to be more culturally aware and culturally appropriate. They're saying, no, the evidence says these babies need to be alone, on their back, and in a crib. Now, the crib can be in the parent's room. You can share the space, just don't share the bed. And so what they've done is they've taken out all of the extra education that they had said, as long as you take the pillows off and the blankets off the bed, the babies will be okay. That's not true. And so there's still accidents that happen. When the AAP pushed out infant safe sleep, they prevented almost 5,000 to 6,000 deaths per year just by placing babies on their back. And so babies that sleep on their tummy have a 5 times higher rate of death than babies that sleep on their back. We tell people in the community all the time, if you know your ABCs, that's the first start. And so babies are, and you'll see in another slide, they're perfectly made to be supine on their back. And what that means is their esophagus and their trachea are situated in a space that if they have regurg or they have reflux or they spit up, that trachea will be protected on their back, whereas if they're on their belly, that's where the milk and the fluid will go. And so families need to understand that, and that's what we teach. And so one of the other things that we talk to families about is smoking cessation. And people think as long as they stop smoking during pregnancy, the babies won't be affected. That's not always the case. And we found that I've been a pediatric nurse for more than 30 years. Smoking around your kids, whether it's vaping, e-cigs, whatever the vice, is really harmful to your children and their development along their stages and milestones. And so what we found is that smoking during pregnancy does increase the risk up to 5 times, with additional risk noted in the postnatal exposure. And so it is one of those modifiable risks now that AAP is putting out to prevent sudden unexplained infant death.